Good morning, everyone. My name is Darina Ipanapita. So today I will be presenting on the importance of training in healthcare, specifically focusing on nursing practice. So this presentation is part of our Policy and Quality Management in Healthcare course with the course code number NBNS 4723. So throughout these presentations, we will explore why healthcare training is essential, the different types of training available, and how it impacts patient safety and clinical performance. I will also share some personal experiences from clinical settings and discuss the challenges nurses face in assessing training along with strategies for improvement. And then let us begin. This slide provides a roadmap of our discussion today. So we will start with an introduction that defines healthcare training and explores how nursing roles have evolved over time. Then we will examine key concepts like competency-based training, lifelong learning, and evidence-based practice. We will also look into theoretical frameworks such as total quality management and the ethical principles that support training. In the second half, we will discuss real-world applications in nursing practice, including personal observations from hospital settings. Finally, we will critically analyze the challenges nurses face and propose strategies for improvement. So I will begin with the introduction. Healthcare training is a structured process designed to develop, enhance, and maintain the clinical knowledge and technical skills that nurses need for safe practice. As healthcare settings become more complex with new technologies, aging populations, and emerging diseases, the need for continuous training has never been greater. Nurses have not just the option, but a moral, legal, and professional obligation to stay competent and deliver evidence-based care. Without ongoing training, care quality becomes inconsistent and patient safety is compromised. This is why training forms the foundation of quality nursing practice. For this slide, I'm going to talk about evolution of nursing roles. So nursing education focuses mainly on bedside skills and procedures. Usually we are trained to follow physician's orders and perform basic care such as checking vital signs and administering medications. However, the role has changed significantly over the years. So today, nurses are expected to demonstrate critical thinking, clinical judgment, leadership, and cultural competence. They must interpret diagnostic data, participate in multidisciplinary decision making, and manage complex medical equipment. So this has changed, reflects the increasing complexity of healthcare systems, which has shifted nursing from one-time education to lifelong professional development. So why training matters? The importance of training extends beyond individual professional development. While trained nurses directly influence patient outcomes and organizational performance, they are better equipped to prevent medical errors, identify early signs of patient deteriorations, manage an emergency, and collaborate effectively with multidisciplinary teams. Training also supports the integration of evidence-based practice, ensuring that nurses apply the most current and effective interventions. Understanding the value of training helps foster a culture of excellence, accountability, and lifelong learning within the nursing profession. Dear colleagues, as you all know, competency-based training is a core concept in nursing education. It defines the specific knowledge, skills, and behaviors required for safe and effective practice, ensuring nurses achieve consistent standards of care. This approach aligns educational activities with real clinical situations and promotes accountability across healthcare system. It is especially important in high-risk departments such as emergency, critical care, and perioperative services, where even a small minors can have serious consequences. Regular re-evaluations based on hospital policy ensures that nurses maintain both theoretical knowledge and practical application skills throughout their careers. So goes to my next slide. Nursing is a profession that constantly evolves with new research, technologies, and clinical guidelines. Lifelong learning ensures that nurses remain proactive in updating their skills at a pace that matches these changes. It helps nurses pursue advanced recertification, expand their scope of service, and take on leadership roles. Without a commitment to ongoing education, nurses risk becoming stagnant in their practice, which can directly affect the quality of patient care. Evidence-based practice, or EBP, amplifies the importance of training by combining research findings, clinical expertise, and patient preference. Educational programs help nurses understand research, apply clinical guidelines, and evaluate the effectiveness of their interventions. EBP ensures that nursing care is grounded in the latest evidence rather than outdated traditions. For example, updated guidelines on infection control, wound care, and medication administration are shared during education programs, keeping nurses aligned with current standards. Without consistent training, nurses may revert to outdated practices, which can lead to unsafe care and poor patient outcomes. Total Quality Management, or TQM, is a framework used in healthcare to deliver efficient, high quality of care. In nursing, TQM helps reduce errors such as medication error and pressure injuries while increasing hand hygiene compliance. It includes monitoring quality indicators like ventilator-associated pneumonia or VAP, catheter-associated urinary tract infections, and patient falls. TQM also focuses on enhancing patient experience, strengthening teamwork and safety culture, and standardizing care through evidence-based guidelines. Ethical principles in training also underscore the importance of training for nurses. Compassion of beneficence requires nurses to act in the best interest of their patients. Non-maleficence places an obligation on nurses to do no harm. Accountability demands that nurses maintain competence throughout their careers, and without adequate training, nurses may fail to recognize patient deterioration, make medication errors, or lack the clinical judgment needed for patient advocacy. Therefore, continuous training is not merely a professional obligation, but an ethically mandatory requirement to ensure nurses uphold their duty of care. There are many forms of training available in nursing practice. General orientation programs introduce new nurses to hospital policies and workflows. In-service training provides updates on new equipment, protocols, and clinical guidelines. Simulation training allows nurses to practice high-risk procedures in controlled environments, building confidence and reducing errors. Emergency drills such as mock codes for cardiac arrest or disaster situation prepare nurses for critical events. Specialty recertification like SCLS, BLS, and PALS ensure expertise in specific areas. Finally, continuous professional development through workshops, conferences, and online modules supports ongoing learning for both new and experienced nurses. Let me highlight some common training examples in nursing practice. Medication safety workshops remind nurses about the 5 rights of medication administration, which help reduce errors. Infection control training improve hand hygiene compliance and use of personal protective equipment, protecting staff, patients, and visitors from harm. Pressure injury workshops help the nurses identify risk factors and implement preventive measures. Code Blue simulations enhance teamwork, communication, and response time during cardiac emergencies. Wound care training ensures nurses can properly assess wounds and select appropriate dressing. Each of these demonstrates how target training strengthens clinical skills and promotes safer patient care. In real hospital settings, training directly influences the quality and safety of nursing care. Well-trained nurses can perform accurate physical assessment, administer medication safely, and recognize early signs of patient deterioration. For example, training on the National Early Warning Score Calculator helps nurses monitor 6 physiological parameters to prevent further decline. In my hospitals, like King Abdulaziz Medical City in Saudi Arabia, we have implemented sepsis awareness programs that successfully reduce mortality rates. Additionally, continuous training ensures nurses can manage complex equipment such as infusion pumps, ventilators, and cardiac monitors safely, preventing equipment misuse that could harm the patient. As a nurse, we are responsible for maintaining our competencies through regular training attendance and complying with updated policies and protocols. Experienced nurses also serve as preceptors, guiding junior nurses and students during clinical placement. In medical units, nurses are trained on strict 2-hour repositioning to prevent pressure injuries, so reporting incidents and near miss is another important responsibility. These practices highlight how training builds not only clinical skills but also confidence and better judgment in patient care situations. From my own clinical experience, I have seen how mandatory workshops and training significantly improve workflow and patient safety. Attending medication safety workshops have helped me to demonstrate better understanding of dosage calculation and double-checking procedures for high-alert medications. I have attended a pressure injury workshop which I improved skin assessment and appropriate dressing selection based on wound stages. Simulation labs were particularly effective in preparing nurses for emergencies like code blue situations, enhancing teamwork and reducing response times. These experiences confirm that training improves not only clinical skills, but also communication and confidence levels among both new and experienced nursing staff. Despite its importance, nurses face multiple obstacles in assessing training. Staff shortage are a major barrier as a nurse cannot leave their patients to attend workshops. Fatigue from heavy workloads reduces motivations and ability to participate in educational activities. Outdated simulation equipment or lack of simulation labs can hinder effective learning. Burnout is another significant factor that discourages nurses from engaging in extra training. Additionally, limited care development opportunities due to lack of managerial support and insufficient financial assistance for external courses further compound these challenges. To address these challenges, healthcare organizations should provide protected time for training while maintaining adequate staffing levels so patient care is not compromised. Investing in modern simulation lab facilities and new technologies is essential for effective hands-on learning. Implementing structured competency assessment programs ensure nurses are regularly evaluated and supported. Encouraging mentorship and leadership involvement creates a culture of continuous improvement. Most importantly, training must be practical, relevant, and supported by preceptors who encourage real-world applications. So when these strategies are in place, training becomes more meaningful and has a greater impact on clinical outcomes. Last but not least, in conclusion, healthcare training is essential to ensure that nurses remain competent, confident, and capable of delivering high quality of care. Training enhances patient safety, reduces medical errors, and strengthens the entire healthcare system. With strategic improvement plans, organizations can maximize the effectiveness of their training programs. Nurses who engage in ongoing training form the backbone of safe, efficient care and represent an essential investment for every healthcare organization. As healthcare continues to evolve, nurses must continue seeking training through workshops, hospital drills, and educational programs to improve their skills, build confidence, and reinforce nursing excellence. Thank you for your attention. These are my reference.